Video 57, Using Media for Advocacy Area v CHES Subcompetencies 5.4.1. Review the learning objectives for this video. Welcome back. I am so glad you are here for this one because media advocacy is where your communication skills and your policy goals come together in a really exciting way. Media advocacy is the strategic use of mass media and community organizing to advance public health policy objectives. It is a specific tool within your broader advocacy toolkit, and it differs from general health communication in an important way. Standard health communication aims to inform and educate the public about health behaviors. Media advocacy aims to shift public discourse and political will toward policy change. The central concept in media advocacy is framing. Framing determines how an issue is presented to the public and consequently who is seen as responsible and what solutions seem appropriate. Let me give you an example that makes this concrete. Consider the issue of childhood obesity. An individual level frame says parents need to make better food choices for their children. This frame places responsibility on individuals. A systemic frame says the food industry spends billions marketing unhealthy products to children, while healthy food is unaffordable and inaccessible in many communities. This frame places responsibility on corporations and policymakers. Media advocates work to shift the frame from individual responsibility to systemic accountability because systemic frames are more likely to generate support for policy solutions. If the public believes obesity is a personal failure, they will resist policy intervention. If they believe it is a product of industry practices and unequal access, they are more likely to support regulation, taxation, and environmental changes. For your exam, remember that media advocacy is always tied to a policy goal. You are not just raising awareness, you are strategically using media attention to create political pressure for specific changes. Your role as a health educator is to identify the appropriate frame, craft compelling messages, and deliver them through the most effective channels to reach the right audiences. You are really developing a well-rounded advocacy skill set here. Now let us look at the three categories of media that health advocates use because the exam may test whether you can distinguish among them. Understanding these categories is going to strengthen your strategic thinking. Earned media is media coverage that you do not pay for. It is earned through newsworthiness. This includes news stories that reporters write about your issue, op-eds and letters to the editor published in newspapers, coverage of press conferences and media events, and interviews with advocates on television or radio. Earned media carries the highest credibility with the public because it appears as independent journalism rather than promotional material. However, you have the least control over earned media because reporters and editors decide what to cover, how to frame it, and what quotes to include. Developing relationships with journalists and providing them with compelling stories, reliable data, and accessible spokespersons increases your chances of favorable earned media coverage. Paid media is advertising and sponsored content that you purchase. This includes print advertisements, television and radio commercials, online ads, billboards, and public service announcements if they are placed in purchased time slots. Paid media gives you complete control over the message, but the public often perceives it as less credible because they know it is paid for. Public service announcements, or PSAs, are a special category where media outlets donate airtime for messages in the public interest, though donated PSA time has declined significantly. Owned media includes channels that your organization controls directly. Your website, social media accounts, email newsletters, blogs, and organizational publications are all owned media. You have full control over content and timing. Social media occupies a unique space because it functions as owned media when you post content, but it becomes a form of earned media when your content is shared, commented on, and amplified by others. For your exam, understand that effective advocacy campaigns typically use all three types of media in a coordinated strategy. Owned media builds your base, paid media extends your reach, and earned media provides credibility and broad exposure. You are really putting together a complete picture of how advocacy works in practice. Let me walk you through the specific media tools that health advocates use most frequently, and these are tools that may very well appear on your exam. Knowing them will give you a real advantage. Op-eds are opinion editorials, typically 600 to 800 words, published in newspapers and online news outlets. The op-ed is written by someone outside the publication's editorial staff, which is what distinguishes it from an editorial. An effective health advocacy op-ed identifies a specific health problem with local relevance, presents compelling evidence, connects the problem to a policy solution, and includes a clear call to action directed at a specific decision maker. Op-eds are powerful because they reach the same audience as news coverage, including policymakers and community leaders who read newspapers. Letters to the editor are shorter responses to articles or topics that a newspaper has already covered. They allow advocates to correct misinformation, reinforce key messages, or add perspectives that the original coverage missed. Letters are often more likely to be published than op-eds because publications receive fewer of them and they require less editorial space. Media bites, sometimes called sound bites, are concise, quotable statements of 10 to 15 seconds that capture your key message in a memorable way. Journalists need brief, compelling quotes for their stories. If you provide a clear media bite, the reporter is more likely to use your exact words. Prepare your media bites in advance. Practice saying your key message in 1 to 2 sentences. Use concrete language and vivid imagery rather than jargon. Social media campaigns leverage platforms to build public awareness and engagement around health policy issues. Effective campaigns use consistent hashtags, shareable infographics that visualize key data, personal stories that humanize the issue, and clear calls to action. Social media also allows direct communication with elected officials who maintain active social media profiles. Press releases are formal announcements distributed to media outlets about newsworthy events, research findings, or organizational positions. A well-written press release follows the inverted pyramid structure with the most important information in the opening paragraph. Include a compelling headline, relevant data, and quotes from credible spokespersons. You now have a full media toolkit at your disposal, and that is going to make you a much more effective advocate. Great work getting through all of this. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is B. Option B demonstrates effective media advocacy because it combines a prepared media bite with strategic framing that shifts the narrative from individual responsibility to industry accountability while connecting directly to a specific policy proposal. Media advocacy always ties messaging to policy action. Option A relies on data alone without strategic framing or a policy connection. Option C describes general health communication, not media advocacy, because it avoids policy specifics. Option D is confrontational and does not advance a constructive policy message. Summarize the key